Hi, David. How are you?
Dr. Khan, good to be here.
And listen, it's great to see you. So this is our third video.
It is, yeah.
And we're just going to have you tell your story. I'm just going to recap for a second. You came in originally with really severe Achilles tendinopathy.
Yeah.
We went through all the stuff, and go ahead and go to town.
Okay, I really wanted to communicate the success. It sounds a little immodest, but I feel like I'm a success story. You know, I sought you out about a year and a half ago, and I had this chronic pain in the Achilles because for 25 years I've been a racquetball player. And if you go online, you'll find 99% of the information is geared toward the chronic injury. I'm sorry, the acute injury,
right,
where, you know, how to deal with it and get back. But very little on this chronic condition. And I put the word cure and Achilles tendon in the same sentence, and lo and behold, you came up with the Shockwave treatment.
Right.
And I said, well, let me pursue this.
Yeah, and we had worked you up with MRIs, and
yeah,
you had tried. Tell me your story. You've been to other docs as well.
I've been to other doctors. I've been
orthopedists.
Yeah, everyone.
Right.
And I got a brace from one doctor. He said, use this, and you know, nothing was that cure. Everything was, as you would say in medicine, palliative.
Right.
And I said, I got to get rid of this. And you know, the good thing about coming to see you, I came in looking for that, the Shockwave treatment. You said, let's work you up to it.
Right.
So you did give me some medication. You did, I think you sent me for therapy.
Yeah, and we also did some of that iontophoresis, the injections without the needles.
Right, we did, oh yeah, the
patches.
The patches. We did a lot of things.
Right.
We really did.
To try and first.
And the one thing, the reason I wanted to make this video also is because, unfortunately, the insurance company doesn't pay
right.
for that treatment for the Achilles tendon.
Right.
They do for plantar fasciitis.
Right.
But this is their...
It's crazy.
It is.
Yeah, because surgery for this, we talked about that as well.
Yeah.
And I'm sure other docs talked to you about that as well.
Well, I was at a point where, you know, I wanted to get back to racquetball.
Right.
And I was thinking, well, maybe I should just have surgery. They'll go in, they'll stitch it up. But, you know, this thing, it's odd, you know, to say to somebody what it is. It's peculiar. But then when you learn, it makes sense. And it worked. And in the beginning, if you remember, after a month, I was much improved. But
right.
Of course, you're looking for better and better.
Right.
Looking to get back on the racquetball
right.
court.
And we this is your third video. We filmed you along the way, so your story is really very well laid out.
Yeah.
And just to remind people how badly it was.
It was so bad that I had to walk down steps sideways.
Right.
And I recall going into Center City for a convention, and I had to take the train, and I was walking down to the platform, and I really felt like an old guy. I'm 66 years old, by the way.
Right, look great.
And, you know, I've been playing racquetball all these years, and this treatment, with your encouragement, and I want to add that, and this is unsolicited, but with your encouragement to, you know, take it easy, don't rush into it, and don't do anything stupid. So I'm encouraging people, like, yeah, I had to make an investment,
right.
But look at the benefit, look at the payoff. So
now let's talk to you about what you told me today, that you're back and
I'm back in racquetball. You know,
15 months later.
If anybody who plays tennis or racquetball knows that there are singles and doubles. Singles is a very demanding game. You got to cover the whole court. Doubles, you know, you have a partner and you're not covering the whole court. And then, you know, I used to play racquetball 3 times a week.
Mm-hmm.
Singles.
Right.
So now I'm playing doubles and starting out at once a week. And you made me feel better today when you said that it'll continue to get better.
Yeah, and you actually are feeling tremendously better, even since it's continued to improve over the last 6 months even.
Yeah, it has. I got to a point in the beginning of this year where I was really kind of getting down.
Right,
Because yes, it was better.
right,
You know, when I sought you out, it wasn't just because I needed to get back to racquetball. I couldn't walk down steps. I
Right.
couldn't walk long distances.
couldn't function.
Yeah, and I had a brother who was in the hospital in New York, and to get there, you had to do, train and lots of stairs.
Right.
I just couldn't do it.
And but the way you're walking now is normal. You're not having pain on a daily basis.
No, I'm not at all. And, a couple of months back, I looked at myself walking downstairs because my office is upstairs. It was like, wow, look at this.
Yeah.
It's just like normal. The thing, too, about it is when you have the pain in the Achilles and you're stepping off a curb, mentally you are stopping yourself from doing it normally. And that compensation isn't good either.
So now you have none of that. That's all.
I don't have any of that.
100% gone.
I'll have some time where I'm a little tired.
Right.
Listen, I'm 66. I'm playing racquetball, so I'm not going to complain.
So things are great.
The things are great, and I'm very happy I did it. So that's my commercial, unsolicited.
Well, I think, again, we talked about this, Dave. We appreciate your sharing your story because we see lots of patients like this. And coming from a patient who's been really through it
I've been through a lot.
and really came in really disabled,
Yeah.
to be at this point with a non-surgical treatment that we did one time,
Yeah.
15 months ago, about a 20-minute treatment. And even during the treatment, you were comfortable doing that
Yeah,
as well.
it's nothing to be afraid of,
Right.
for sure. I mean,
Right.
Listen, people in my age group can go for a colonoscopy.
Right.
They can do this.
Right.
So anyway,
So you're a great patient.
Dr.
We love you too. You're a pleasure to treat. Thanks again, Dave.
All right, thank
Okay,
you.
You got it.